What matters, however, is how we measure blood pressure. We can measure blood pressure with an A-line, which is an invasive continuous monitor with all of its complications from vascular injury to problems in vascular paths of putting in an A-line and then maintaining an A-line afterwards. We can do standard non-invasive intermittent measurement, as we know, the standard blood pressure cuff that we can cycle multiple times. But how about if we have non-invasive continuous? That should be the ultimate goal. If we can save ourselves from injuring a blood vessel, still get repeated blood pressure measurements so we don't miss periods of hypotension and still have the same validity as a arterial line. Now, do arterial lines prevent hypotension? We saw in a small randomized trial that they do. They significantly detect more hypotension, about twice the amount of hypotension that a blood pressure cuff detects. That's all good. Do non-invasive continuous blood pressure techniques detect and correct more hypotension? The answer is yes again. So again, in a randomized trial, it was seen that a time-weighted average MAP less than 65 using unblinded continuous non-invasive blood pressure measurement techniques led to way better detection and possibly more correction of hypotension. That's why there was less hypotension in the arm that had the ability to respond to continuous non-invasive blood pressure versus the arm where this was kept blinded. This is validation study of the caretaker device, shows very good data, both with diastolic pressure, systolic pressure, and MAPS, comparing it to standard A-line pressures. So clearly we have the opportunity to have non-invasive devices that will continuously measure blood pressure and would be validated as good as an invasive arterial line.